Today I have made this video to give information regarding one severe disease, thalassemia. Thalassemia, whether it is prevalent in India, yes. India is the leading country having maximum number of patients in the world. About 40 to 40 lakh people are carrier. They are not patient, they are carrier. Means it is a genetic disease and it is a hereditary disease. So the person having defective gene and carrier are called as a minor thalassemia. So it is observed that in India about 45 lakh people have defective gene for hemoglobin production. But the problem is that they do not suffer whenever the patient is having minor thalassemia. There is no much adverse impact on the life of these person. But if two minor thalassemia person marry with each other, meaning is that one lady marry with the person having thalassemia minor disease. At that time, there is a chances that their offspring, 25% offspring, will suffer from major thalassemia. Again, the question arises, how many patients are there in India with major thalassemia? Approximately 1 lakh to 1.5 lakh patients are there in India suffering from major thalassemia. And every year, about 10,000 to 15,000 major thalassemia patients are added in this number. Means the newborn with a defective and suffering from major thalassemia are about 10,000 to 15,000 per year. Now you will ask me, what is a thalassemia? Thalassemia meaning is that it is a defective hemoglobin. You know the role of hemoglobin in our body. It is present in RBC and the main function is to carry the oxygen. If the hemoglobin is inactive or hemoglobin is a defective, it cannot properly carry the oxygen. Generally, the life of RBC in your body, in my body, is 120 days. But if the person is suffering from major thalassemia, the life of RBC is only 10 to 25 days. And what are the symptoms again? Symptoms are that the nail and tongue appears yellow in color, reduction in weight, then weakness, difficulty in respiration, difficulty in urination, and many others. Generally, this disease is detected within 2 years. Doctors will detect in the newborn child within 2 years this disease. And again, I am telling you why I have made this video. The reason is that the children or the newborn baby or newborn boy will suffer from disease throughout the life because it is a genetic disease and for his no mistake. Meaning is that the mistake is of ignorance of his mother and ignorance of his father. Whenever new couple is marrying, they should check whether they are carrier of thalassemia defective gene. Means whether they are having minor thalassemia, you must detect. If you are a negative carrier, marry with minor thalassemia carrier, there is no problem. Issue will be all right. If the either boy or girl, one of them is only minor thalassemia and other is without thalassemia, defective thalassemia, there will not be any problem. But if both of them are minor thalassemia, then their offspring, there are chances 25% of the offspring will suffer from major thalassemia. Now, naturally, will ask me, what is the treatment? There is no treatment for this disease. So, only we have to do regular exercise, yoga, change the diet habit, meaning is that food should have maximum folic acid, vitamins, and iron content. And you have to change the blood. Means every 4 to 6 weeks, one bottle of blood should be given to the patient. You see, it is again increasing the risk of other diseases while transferring the blood. That's why throughout the life he has to take the fresh blood every 4 to 6 weeks. Again, one more treatment is available, bone marrow transplantation. But it is a very costly in India. The cost is from 15 lakh rupees to 45 lakh rupees. Again, I am reiterating, without any mistake of the boy or girl, newborn, they are suffering lifelong from this disease. So what we have to do? We have to take a precaution, test whether you are a carrier of defective gene for hemoglobin. And if you are a carrier, take precaution that do not marry with the other carrier minor thalassemia person. Otherwise, these boys or girl, they die before 20 years because you see they are always suffering from one or other disease. Their lifespan, 50% of them die before attaining 20 years. So, this video I have made only to create awareness among the young generation. Young generation is not quite aware of this. I am requesting them, learn this and test. How you have to test? Go in pathological laboratory, either through the blood RBC characteristics and the electrophoresis. It cost maximum 1000 rupees. The laboratory person or doctor will tell you whether you are having defective gene or not. So take precaution and make healthy India. Thank you. Thank you very much.